Hello, everyone. I'm Ezrina. Often people ask me, how do I get someone to go into therapy? And I tell them, I say very often people will only choose therapy when the anxiety or the distress outweigh the coping or the payoff. So what that means is in our younger years, in our youth, we have a lot more coping capacity because we have less years experience. So we get through our experiences and we sort of just tuck them aside and we continue to cope and continue with our lives. What happens is unprocessed experiences will accumulate the anxiety until it uses up our coping capacity. So it's when our coping runs out or our payoffs sort of run out that we then choose therapy. So, for example, if we have a traumatic experience in childhood and we don't process it, it actually contains a residual charge, which will then often present as a symptom of anxiety. We don't really address that when we're continuing to cope. And even the negative behaviors we will continue using because we're getting a payoff from them. And the payoff may seem negative, but we're still getting something from it. So, in early childhood, when we have a negative behavior, it can be functional because it serves us somehow or it keeps us in survival. When we grow into adulthood and we're still using these behavioral mechanisms, they actually become dysfunctional because the environment has changed, yet we're still using the mechanisms. So we're still getting a payoff, albeit negative. So it isn't actually until our anxiety or our distress outweighs our coping ability or our payoffs that we actually choose therapy. So keep that in mind.